Well, back here at home, the Hill's race and politics reporter Cheyanne Daniels took a deep dive into the Black maternal mortality crisis. She sat down with our Sally Hernandez to give some insight on her reporting called The Switch Up.
We have race and politics reporter Cheyanne Daniels here to talk a little bit about this new investigation you have been working on. Tell us more about it.
Absolutely. So, what we've been taking a look at is how the maternal mortality crisis is affecting Black women, particularly when it comes to mental health availability services to help women dealing particularly with postpartum depression.
You know, this is something that our investigators here, Cheyanne, have been looking at statewide and locally, but you're kind of putting this into a national perspective as well. What did you find out when it comes to why are Black moms out there being hit so hard by this?
So, one of the biggest reasons for this is because postpartum depression does not present the same way in Black women as it does in, for instance, white women. And so, when we think about, for instance, even just terminology, white women perhaps will say that they're depressed, but for Black women, the words that they might use, for instance, could potentially be irritable. Or I'm not myself, or I'm frustrated. And those types of comments or those types of words often go overlooked in screenings that are meant to be able to capture any sort of onset of this postpartum depression.
And if we do have a mom out there who says, I'm suffering and uses the language that maybe is ringing the ears of a doctor, do they get the help they need?
So this is unfortunately where we start to see some of those gaps. Oftentimes, no. And there's many reasons for that. First of all, we already know that access to healthcare for Black and brown women is less easily accessible than those who are white women. We also know that there are economic barriers in the way as well, but also there's still a little bit of stigma around mental health, and that's in every community that we look at. And so the idea of coming forward and saying that I'm struggling is not something that Black women find themselves able to do often for a multitude of reasons.
You know, I think a lot of reasons have to do with, I think women, you know, moms especially, we think that we can take on everything. So it's maybe not as easy for us to say, you know, we need help with something. But with your research that is out there and everything that we now know, what are lawmakers, if anything, doing about it?
Absolutely. So we know right now in Congress that we have the Moms Matter, right? We have the Black Momnibus working to get through Congress to be able to have services put in place for Black moms. We know Vice President Kamala Harris is dedicated to this issue, particularly solving the maternal mortality crisis. And we've seen parts of the Momnibus signed into law by President Biden, but there's still other aspects that advocates and lawmakers are still really pushing for. But the biggest thing that lawmakers are very proud of is being able to extend Medicare coverage for postpartum, right? So for a while, there wasn't really any availability for Medicare services once a mom gave birth, and now they've been able to extend that for up to a year in some places, which is really important because if you think about what moms go through postpartum, right? It's not something that ends 2 weeks after you give birth, and so that was the big thing that lawmakers really wanted to get through, and we're seeing that come to fruition. So a lot of work being done, but lawmakers and advocates both saying a lot still left to be done.
And we can read more about that next week, right, with your special investigation?
Yes, absolutely. So my investigation again will focus on how we need to create a system that is sort of interlinked between physical and mental health for Black moms to help close that maternal mortality gap.
Thank you so much for all you do and for joining us today.